Hello, my viewers. Welcome back to my YouTube channel. It's another day that the Lord has given unto us, and it's my hope that you're blessed, and I'm blessed too. So I want us to continue with our previous discussion, whereby we were discussing on hypertension. So today I want us to look at management of hypertension. And remember that I said I'll be targeting on the individuals there or out there who have not yet developed hypertension. So what I want us to look at today is what we call non-pharmacological treatment of hypertension. When we talk of non-pharmacological treatment of hypertension, we are simply talking about lifestyle modification, since there are no drugs in non-pharmacological management. So we are talking of lifestyle modification. I want us to look at some of the things that we as human beings we can do in order to prevent hypertension. One, we have to look at weight management. Remember, the more you weigh, the more blood flow you need to supply oxygen and nutrients into your tissue. And as the volume increases in your vessels, so does the pressure in the arteries, and that can lead to high blood pressure. So there's need for you to look or to consider weight management. Look for ways in which you can manage your weight. Make sure that your BMI is okay. You are not obese, since that can lead to hypertension. Secondly, I want us to discuss about salt intake. I know there are those of us that like taking a lot of salt in our diets. Actually, this can lead to hypertension because too much salt can cause your body to retain fluids and also cause constriction of your arteries, and that will automatically lead to increased blood pressure. So check on your salt, the amount of salt you take in your diet, and minimize it as much as possible so as to avoid developing hypertension. The other thing that we are going to look at is what we call dietary potassium. Maintain adequate dietary potassium. Remember, potassium helps in regulation of or in balancing of the amount of sodium in your cells, and also causes the smooth muscle cells in your arteries to relax, and that will lower your blood pressure. So there is need to take adequate potassium in your diet. The other thing is engage in aerobic exercise. I know most of us are lazy. We don't like doing exercise. What I want to tell you today is that exercise is very important in our day-to-day life, because exercise will increase blood flow in all the arteries in your body, and that can lead to release of natural hormones and cytokines that relax the blood vessels, which in turn lowers blood pressure. So engage yourself in exercise. Look for, I think we have so many exercises that we can do. You can do riding, you can do walking, playing. Just do something to make your body active. The other one is excessive alcohol intake. Too much alcohol intake can cause hypertension by acting on your adrenergic nervous system and also causing constriction of blood vessels, which will lead to increased blood pressure. So those of you that take alcohol, make sure that you don't take excess of it, because it's a risk factor to hypertension. The other thing is smoking. Avoid smoking. Also avoid dietary saturated fats and cholesterol, because those are also other risk factors that can lead to developing hypertension. So those are the things that I wanted us to discuss. Those are the life modifications that I wanted us to discuss. So it's my hope that you have learned something and you're going to do something in order to prevent hypertension or to avoid these risk factors which will lead to developing hypertension. Remember, you are not yet, you don't have hypertension, and I want you to do something so that you may not develop. Remember, our target is to decrease or to avoid the increasing rate that we saw in the previous video. Uh, I don't want to talk much about the pharmacological treatment, but let me just mention some classes of the drugs that we normally give in pharmacological treatment. So we have the antidiuretics, like the Lasix. We also have beta blockers, like the Carvedilol. We have angiotensin converting enzyme inhibitors, like the enalapril. We also have angiotensin receptor blockers, such as losartan. We also have calcium channel blockers, like the amlodipine, nifedipine, and all that. We also have another class we call vasodilators, like the hydralazine. We also have central acting drugs like the methyl. So those are the classes of drugs that we normally give, and that is to those who have already developed hypertension. And one thing you have to know is that we just don't give anyhow. There is the procedure or there are the steps that we normally follow in giving hypertensive drugs. You start with this class. If this one fails, you do this and this and this. So there is a way in which we normally give an antihypertensive, and I don't want to talk more about that since I was focusing on those who have not yet developed hypertension. So it's my hope that you are blessed with our today's presentation. So kindly, you are out there, you have not yet developed hypertension, uh, do something, uh, act on this lifestyle modification, and I'm sure that you will be blessed. So today we'll stop there, and thank God for that section. And it's my hope that we will be helped, and we will also help the society out there. So have a blessed day, and may God bless you all. Thank you for watching.